Good day, everybody. My name is Zainab. That's Ali. I'm a Nigerian. I have adult polycystic kidney disease, and it was at its last stage. Nigeria, when I became sick, and there was nothing. I've had this disease for almost 17 years, but the kidneys were functioning well until later on gradually they deteriorated about 9 years ago. So I became very sick, and then I inquired, and I started dialysis. But the dialysis, I got infection, and I'm always having fever. I couldn't eat. I was very sick. So one of the nephrologists in my country suggested that I have a kidney transplant. And I got talking, and he told me that India would be the best place to come. So at first, somebody told me to go to Apollo Hospital in India, but then we now inquired from another doctor that had been to India, and he came to BLK, and he told us that BLK would be the best choice. And so we decided to come here. When I came, I was very sick. I couldn't eat, I couldn't do anything. And I came with fever and everything. But I was hopeful that I was going to get well. But when we came, there was a lot of obstacles, because first, my daughter was taught to, who later also became my donor, was taught to have a cyst also. So we had to do the gene type testing. And then my kidneys were so big that one had to be removed before the transplant would take place. So I underwent nephrectomy, and after that, after carrying out all the tests, it was also found out that I had too high, my titer value for my antibodies was very, very high. And to do a transplant at that time would have been very wrong, because the kidneys could be rejected. So at that point, I was actually very frustrated. I became angry. I was fighting the staff, but they understood. Even when I fight, they calm me down, because I was so frustrated. I thought it was going to happen. It was not going to happen. I was thinking of going back to my life of suffering back when I was in Nigeria, and that was why I became frustrated. In fact, Sunil usually called me the angry young lady. But he said that pushed him. Dr. Sunil, who is the director of the nephrology department, is a very understanding man. They were gentle with me even in my times of need, in times of my trials. They were very, very understanding. So because of the high level of antibodies in my blood, I was asked to do to do plasmapheresis. And I was afraid, because a patient that told me before that it was very serious and exhausting, even more than dialysis. So I went to the dialysis unit and I asked the person in charge, and he told me that no, it's not that. So I became relaxed. I had to do 7 sessions. And at the 7 sessions, fortunately, the antibodies went down. And even though there was still some high level of risks involved to carry out the transplant, we said we are going to carry it out. Especially my husband, my daughter, and my sister that came with me. So the transplant was done. And thanks to God, it was very successful, beyond expectation. And they told us that it was a good choice. But they all worked very hard. The nephrology department has been very understanding, especially Dr. Sunil and all the other doctors that are with him. They are all professional here. They know their work. So anybody, I will ask anybody to come to BLK. You might think that they're asking you to do too much, but at the end of the day, it is for your own good. And the transplant will turn out very well. Because it is better to carry out all those things rather than carry out the transplant and then have to come and do other things later. My transplant was very successful. I feel very healthy. I can eat. I can walk distances. I climb stairs. I'm happy. I thank God, and I thank the nephrology department of BLK. They're very good. Thank you very much. That's my honest view of the nephrology department headed by Dr. Sunil Prakash. Thank you very much.